Hello, my name is Dr. Greg Johnson, and I am an internal medicine doctor at Atrius Health. I wanted to talk to you today about the COVID-19 vaccine. I believe the vaccine is the best way to protect ourselves, our families, and those around us to finally end this pandemic. This is why I got the vaccine. I urge all of my patients to get the vaccine, but I especially encourage all of us in the African American community to get the vaccine as soon as possible. COVID-19 is hurting us particularly hard. Across the country, blacks are almost 2 times as likely to die of COVID-19 as whites. I know some of us had concerns about the vaccine. I know some of this comes from the way we have been treated by the healthcare system and the government in the past and the present. It is natural and expected to have questions and mistrust related to the vaccine. However, I want you to know that I have read the studies and reviewed the data. I believe that all 3 of the vaccines are safe, effective, and will save lives. And I believe that people should get any vaccine that they can when it is available to them. In this video, I hope to give you a better understanding of how the different COVID-19 vaccines work, how safe the vaccine is for most people, including those with allergies or who are pregnant, and why it is more effective and better than getting COVID-19. Again, I urge you to get any COVID vaccine that you can get as soon as you can. Getting the vaccine will protect you, it will protect your community, it will protect the population, it will prevent spread. But most importantly, it will allow us to get back to the things in your life that you have missed over this past year. Thank you for listening. All of the different COVID-19 vaccines allow people to develop immunity without being infected with the virus that causes COVID-19. The vaccines do not contain any part of the live virus, so you cannot get COVID from the shot. The vaccines all provide instructions that tell the body how to launch an immune defense against the virus. The vaccines are safe. The same safety guidelines used for all vaccines were also followed for the COVID vaccines. The COVID vaccines were developed quickly because of a record number of scientists working together on the vaccines over the past year. After the FDA reviewed the studies and authorized the vaccines, objective public health experts, infectious disease doctors, and vaccine specialists reviewed the science as a way of being extra sure that the vaccines are safe. No safety steps were skipped. Tens of thousands of people, including the elderly, people with multiple medical conditions, and people from racial and ethnic backgrounds who look like us, volunteered to get the vaccine and prove that it was safe. Since then, tens of millions of people of different races and ethnicities have gotten vaccinated and only experienced mild side effects. All COVID-19 vaccines currently available are incredibly safe and effective. In the studies, people who have received the vaccine were about 20 times less likely to get COVID-19 than people who did not get the vaccine. They also prevent serious COVID-19 illness that requires hospitalization or lead to death. Even people who are young and healthy can get very sick with COVID. Because of this, it is better to get vaccinated and become immune rather than wait and possibly get COVID-19. After vaccination, people may get mild side effects like arm soreness, body aches, headaches, or fevers. This just means that your body is building an immune defense to the virus. These symptoms go away after 1 to 3 days and can be treated with medications like Tylenol or ibuprofen. We now know that vaccines are so effective that people who are vaccinated can safely visit with other people who are not vaccinated, as long as the unvaccinated people do not have conditions that put them at risk for severe illness with COVID-19. But until more people are vaccinated, you'll still need to wear a mask in public and avoid crowded spaces even after you get vaccinated. If you are pregnant, or if you have an underlying condition or take medications that weaken your immune system, You can get the vaccine, but we strongly recommend you speak with your healthcare provider first. He or she is in the best position to help you understand what is best for you based on your health. If you have had an allergic reaction to a prior vaccination or an injected medication or to any of the ingredients of the vaccine, you should also talk to your healthcare provider to see how you can get a vaccine safely and if special precautions need to be taken. There have been some instances of severe allergic reaction to the vaccine, but these have been very rare and pose a very small risk as compared to getting COVID-19.